Hello, I'm Joe Johnson and I've been researching bronchitis and exploring new treatments for bronchitis for the past 8 years. What I want to look at today is the question many people ask me, is bronchitis contagious? So is bronchitis contagious? Can you spread it? Well, first of all, let's have a look. First of all, what is bronchitis? You breathe in through your nose or through your mouth, and it joins a windpipe which is at the back inside the neck, and it goes down to here and then it splits off, so it's like a Y shape upside down. It's like that. Now where the windpipe comes down and splits, that is the bronchus. That's what it's called, the bronchus, and it splits off into ever smaller tubes to get the air deep into your lungs. These tubes, well, it starts at the bronchus, then as it splits off into the smaller tubes, if you've got a weak immune system, or for some reason you've got an infection in there, that is bronchitis. Now, I've no idea, if you've got bronchitis now, I have no idea what particular strain of bacteria that you've got infected with, but in general, bronchitis is not contagious. Very rarely is it contagious, but sometimes it is, and it depends on the type of organism which is living in your lungs and living in the bronchus. So that's the question. Is it contagious? Not often, but yes, it is, and it can be. So what can you do about it, more to the point? Well, no matter what kind of bronchitis you've got or what you think you've got, my advice is go to a doctor and get yourself checked out, because bronchitis, if it's left untreated, can be serious. Okay? But if you've got bronchitis now, the chances are you've had it before, and let me explain. This is what happens. For whatever reason, people are either tired or exhausted, or they've been through an emotional time in their life, or there's been problems at work, they've lost their job. There's something that has stressed the body, and the immune system gets weak. It opens a doorway, and the bacteria or germs, whatever, they get in, and if they get into your lungs, they start to breed. Inside there, it's warm, it's damp, it's full of food, it's everything the bacteria could want, so it starts to breed easily. So people start to produce a lot of phlegm and mucus, a lot of coughing. They go along to the doctors, the doctor gives them antibiotics, and it works. This is it. The first time it definitely worked. Almost always it worked. They'll give you the antibiotics, and what these antibiotics do, they literally blast and kill the germs in your lungs. But what they also do is further weaken your immune system. So what that means is you get rid of your bronchitis, and that is fine and that is fantastic. But the antibiotics have left your immune system weak, which means they've left your lungs open to further infection. And within a month or two, certainly within 6 months, the chances are you'll be coughing again, wheezing again, in pain again, a lot of mucus and phlegm. So you go back to the doctors, and the doctor says, I will give you a stronger antibiotic. Well, you can see a vicious cycle here, and it gets worse and worse and worse. They end up putting you on steroids or steroids, whatever you want to say. They put you on stronger pills. So what's the solution? Right, well, first of all, if your bronchitis is contagious, stay away from other people. You don't know whether it is or it isn't, so in general, stay away from people. But the important thing is get it treated. If you've already been treated with antibiotics, and here you are, what I would do is go to bronchitis-relief.com. You'll see that on the screen there. What I did was, I looked for a treatment that doesn't damage your immune system, that doesn't go off into all your blood supply, that goes off into your brain, into your blood, into your organs, and generally weaken everything. What me and my colleagues did, we've come up with a treatment that just specifically and locally treats your lungs. It kills the bacteria in your lungs. That's it. Which allows you to clear the infection, to clear the mucus and the phlegm, stop the pain, stop the coughing, get your energy back and get on with your life. That's it. So Is bronchitis contagious? Yes and no, depending. Either way, get it treated, and get it treated in such a way that it doesn't come back. Right, well, hope that little bit of information was helpful for you. There's tons more videos on bronchitis at bronchitisrelief.com. Thanks, bye for now.